In this video, we'll talk about bedridden clients. The definition of bedridden. A bedridden person is someone who's unable to turn or reposition themselves independently in bed, or someone who cannot transfer to or from a bed. Complications arise when a person is sitting or lying in one position too long. They run the risk of skin breakdown. A skin breakdown is known as a decubitus ulcer, pressure sores, or a bed sore. These skin breakdowns take place on what we call the bony prominence. It is on the head, the shoulder, the sacrum, the buttocks, the heel, and the hip. Stages of skin damage. Stage 1, the skin is reddened and the color does not return to normal 20 minutes after the pressure is relieved. The skin remains intact. Stage 1 on this heel, you can see it is just very red. The skin is very dry around it. It is only affecting the top layer. But as you can see in stage 2, you're looking at 2 to 3 layers. Stage 2, there is a partial thickness skin damage affecting the outer skin layer, which is the dermis, and the layer right below it, the dermis, or sometimes both. The ulcer is superficial and looks like an abrasion or a blister. As you can see, stage 3 will affect the epidermis, dermis, and subcutaneous fat. In stage 3, this involves the full thickness of the skin, and it is extending into the underlying tissues. This deeper layer of skin tissue has a relatively poor blood supply and can be very difficult to heal. As you can see, stage 4 is the most serious. It affects the epidermis, dermis, subcutaneous fat. It goes into the muscle and even into the bone. Stage 4, there is a full thickness of skin loss with extensive destruction, tissue dying, or damage to the muscle, bone, or supporting structures. Now, in Nevada, state regs say it must be in the process of healing. Prevention. The best prevention is to make sure that you are changing that individual's position every 2 hours. If the area stays red for more than 20 minutes, reduce the time by changing the position every 30 minutes. The best practice would be that you start checking the feet and the heels of your residents daily. You want to make sure that you are repositioning them often if they are in a wheelchair. It is your responsibility to reduce the risk of pressure sores for your residents.